Hello, everyone, and good morning. I'm Stephanie Maselli. I'm a media officer with the National Academies of Sciences, Engineering, and Medicine. Thank you for joining us for the webinar for our recently released report, Premium Cigars, Patterns of Use, Marketing, and Health Effects. And to read the full report and related resources, you can visit nationalacademies.org/premium-cigars-study. And for those of you who are not familiar with the U.S. National Academies of Sciences, Engineering, and Medicine, we are private nonprofit institutions that provide independent, objective analysis and advice to the U.S. to solve complex problems and inform public policy decisions related to science, technology, and medicine. And for each requested study, panel members are chosen for their expertise and experience, and they serve pro bono to carry out the study statement of task. The reports that result from the study represent the consensus view of the entire committee, and they must undergo external peer review before they're released, as did this report. Now, we have here with us several members of the committee that wrote the report. We'll first start off with an overview of the report's conclusions and recommendations, then we'll open it up for audience Q&A. And before we delve into that, just a few reminders for you. This webinar lasts an hour. We'll start with that presentation summarizing the report. Then we open it up to your questions, and to submit a question, you'll see a Q&A box on the bottom left of your screen. You can simply click that. And should you have any technical issues during this webinar, you can contact Zoom technical support at 1-888-799-9666 and select option 2. And now I'd like to introduce our panelists. We have Stephen Teutsch, who's the chair of this committee that wrote the report, and he's an adjunct professor at the University of California, Los Angeles, and senior scholar at the University of Southern California's Leonard D. Schaefer Center for Health Policy and Economics. We have Neil Benowitz, professor of medicine at the University of California, San Francisco. We have Christine Del Nevo, director of the Rutgers Center for Tobacco Studies, and a professor in the Department of Health Behavior, Society, and Policy at the Rutgers School of Public Health. We have Miranda Jones, an assistant professor of epidemiology at the Bloomberg School of Public Health at Johns Hopkins University. And we have Kimberly Landrum Sterling, an associate professor of health promotion and behavioral sciences in the School of Public Health at the Dallas campus of the University of Texas Health Sciences Center. And with that, I'll hand it over to our panelists.
Thank you very much, Stephanie, for that introduction, and welcome to everyone. Next slide. Stephanie introduced those of us from the committee who are here today, but here is the entire roster of the committee. It was an extraordinarily expert group with experience in epidemiology, toxicology, tobacco regulatory science, behavior independence, product abuse and liability, as well as other disciplines. Next slide. So we were charged by the Food and Drug Administration and the National Institutes of Health to undertake a comprehensive and systematic assessment and review of the scientific literature surrounding particularly premium cigars. We were asked to look at the patterns of use for not only premium cigars, but how they compared to other cigar subtypes and other tobacco products, and to look at how they are being used by different populations. Key to our report was also the evaluation of the evidence on short and long-term health effects related to premium cigars. Finally, we were asked to prioritize a set of recommendations for federally funded research. Next slide. For those of you who are not familiar with the National Academies Committee process, what we undertook was a fairly typical process, although rather than meeting in person, we had 5 virtual meetings. And those meetings were designed first to gather information from stakeholders, and those meetings were open to the public. The committee then had a set of deliberative meetings to go over what we had learned and to discuss our findings and come up with a set of conclusions and recommendations. We had an initial list of research objectives and questions that was provided by FDA and NIH, and those were then supplemented by information we received from stakeholders, both at our meetings as well as in writing. We conducted a systematic literature review and reviewed those articles carefully and assigned a quality assessment to them. But I'll signpost here that unfortunately there was relatively little research, particularly on the health effects that were specific to premium cigars. And you'll hear more about that as we go through the presentation. We had a set of criteria for levels of evidence and conclusions that I'll discuss in a moment. Importantly, we commissioned 6 additional analyses to supplement the information that we were able to get from the literature and from the stakeholders. We wrote a 6-chapter report. You'll find that with 13 findings, 24 conclusions, and 9 priority research recommendations. Once that report was drafted, it was peer-reviewed by 12 reviewed by 12 experts and subsequently revised to address their concerns. Next slide. So a little background. Beginning in the 1990s, there was a gradual increase in the number in cigar consumption, and that led to a review of cigars. That comprehensive review was prepared in 1998 under the auspices of the National Cancer Institute. And as I said, this was the last comprehensive review, so it's been well over 20 years since there has been such a review of cigars. I'd also like to note on this graph that there are significant changes in the patterns of use of both large and little cigars, and many of those changes came in response to regulatory or pricing issues that you can see on the figure. One of the challenges that we faced was that there was no single consistent definition of premium cigars, and we'll talk about the definition that we ended up using. And importantly, the cigars were deemed under the FDA authority in 2016, and has been an important subject for them since that time. Next slide. So let me begin with the end and talk about some of the overarching messages of our committee. First, the committee found no material difference between products typically considered premium and other cigar types in terms of the harmful or potentially harmful constituents of the tobacco or the tobacco smoke. Nonetheless, there is a meaningful difference in how the products typically are used in terms of the frequency of use, depth of inhalation, and the demographics of the users. In particular, premium cigars tend to be used less frequently than other combustible products and are less intensively inhaled. So while the products are inherently harmful, the committee noted that premium cigar patterns can change due to many factors, such as regulation, marketing practices, consumer awareness, or prices. So finally, while the tobacco products are inherently harmful, the patterns of use do change, and not only the patterns of use in terms of the inhalation and frequency, but by whom they're used and how they're used, and the combination of the toxicity of the product plus the frequency and how they're used determines their health effects. So as the patterns of use change, the health effects will change as well. Next slide. So we were not charged with recommending a regulatory definition of a premium cigar. However, we needed to have a working definition so that we could do the research that we were asked to perform. So we arrived at the following definition, that a premium cigar had to have the following 6 characteristics: that it was handmade, that the filler was composed of at least 50% natural longleaf filler tobacco, that it was wrapped in whole leaf tobacco, weighed at least 6 pounds per 1,000 units, and you'll hear more about that later, that there were no filters or tips, and had no characterizing flavor other than tobacco. And you should note that we derive this definition largely by a careful review from what has been used in research, regulatory filings, legal cases, and so forth. So you may ask, why is price not on this list? And there were several reasons. First, of course, the price is in part due to some of the characteristics that you see here, which are intrinsically more costly. But price can be affected by taxation, so it varies. The price can be altered by industry. So we did not think it was as useful a criterion as the others. Nonetheless, it does serve as a proxy for the first three attributes of the committee's definition, and at times we turn to price as a proxy when the detailed information wasn't available. Next slide. So the report focused on 4 areas: the characteristics of cigars, patterns of use, marketing perceptions, and health effects. And you'll hear details about that in a moment. Next slide. The committee developed an evidence framework for its work to basically classify the conclusions based on the strength of evidence. And those range from not having available evidence or insufficient evidence all the way up to being conclusive. And when we use the term conclusive, we mean that the observed associations between premium cigar use and the given outcome are very unlikely to change with new evidence. And as you move down the scale, the evidence becomes progressively, or those conclusions become progressively less certain. Importantly, premium cigar is a term that's not used systematically in research. So this presented an issue for us. And because of the limited information, particularly on health effects, the committee needed to piece together the information based on what is known from the extensive literature on the constituents of tobacco and tobacco smoke and those biological effects, and what we know about premium cigar constituents as well. Next slide. So just a little about patterns of use. As you know, there are a wide variety of cigar products on the market. Typically, the definition that's used for premium cigars is more than 6 pounds per 1,000 units. But as you'll hear, most are substantially heavier than that. Premium cigars actually make up a small percent of the total cigar market, with about 1% of the US adult population smoking premium cigars. And you can see the figure here that amount has been relatively stable and is significantly lower than that for non-premium cigars. Next slide. So the majority of premium cigar users are, as you can see here, are male. They're white. They tend to have higher income and education levels, and indeed they tend to be older than by about 7 to 10 years than smokers of cigarillos and filtered cigars. Importantly, youth actually only make up a very small proportion of users of premium cigars, less than 1%. At present, the frequency and intensity of smoking is lower for premium cigars compared to other types of cigars and cigarettes. And premium cigar users are less likely to smoke cigarettes or other cigar types concurrently than are other cigar type users. Next slide. So with that, I'm going to turn the floor over to Neil Benowitz, who will start walking us through some of the conclusions. Neil, over to you.
Thanks, Steve. So the context in which the analysis of health effects was done was looking at the known health effects of cigarette smoking. That's been well characterized. We know what constituents of cigarette smoke cause disease. We know the mechanisms of disease. And so the first question we asked is, what is in the cigar? If we look at the leaf material called the filler in the cigar, the toxic constituents in premium cigar tobacco are pretty much the same as those in cigarettes and other cigars. Now, what people take in is not the filler, they take in the smoke. And the data on the smoke, the toxicants and cancer-causing chemicals in cigar smoke are basically the same as cigarette smoke. So if you take in the same amount of smoke from a cigar as from a cigarette, you're likely to suffer the same health consequences. And we know for cigarette smoking, this includes cardiovascular disease, chronic lung disease, cancer, and many other diseases. One difference between premium cigars and cigarettes and small cigars is the pH, which is the acid base characteristic of cigars. If the pH affects the inhalability of the product and also where nicotine is absorbed. So cigars tend to be on the alkaline side, which means a higher pH, and cigarettes tend to be on the lower pH side, meaning more acidic. For cigarettes, it's pretty easy to inhale a cigarette. The pH of cigarette smoke is between 5.5 and 6. So you can inhale it easily. Nicotine does not get absorbed in the mouth. So if you put cigarette smoke in your mouth, nothing gets absorbed until you inhale it. Cigar smoke, which can have pHs up to 8, is more harsh. So it's harder to inhale deeply. On the other hand, nicotine is absorbed easily through the mouth. So you can take cigar smoke in your mouth and absorb nicotine. So these factors can substantially influence how a person uses a cigar versus a cigarette. Next slide. So cigar smokers are exposed to significant amounts of nicotine and harmful and potentially harmful constituents. And this table gives you an idea about what cigars look like. So National Academy commissioned a formal study to look at a wide number of premium cigars and look at their characteristics, including weight, nicotine content, and other aspects of the cigar. So first, the mean weight of a premium cigar in our study was 14 grams. This compares to 0.8 grams for a cigarette. If we look at pounds per thousand, this averages about 30 pounds per thousand, which is way above the definition of 6 pounds per thousand. If you look at nicotine concentration, the average nicotine concentration was about 20 milligrams per gram of filler, compared to cigarettes, which are 10 to 15 milligrams per gram. If you look at the total nicotine in a premium cigar, which is the product of the weight of the cigar by the nicotine concentration, the average premium cigar contained 300 milligrams of nicotine. The largest cigar contained 600 milligrams. By contrast, a cigarette contains about 10 milligrams. So the average premium cigar contains 30 times the nicotine of one cigarette, and the largest cigar, 60 times the amount of one cigarette. So you can see that there is potentially a lot of exposure to constituents depending on how these products are used. Now, it should be noted that someone smoking a large premium cigar doesn't smoke the way a cigarette smoker smokes. A cigarette smoker smokes their cigarette in about 7 to 10 minutes, taking 7 to 8 puffs. A large cigar can take 2 hours to smoke. And some people with large cigars just don't smoke the whole thing at one time. They smoke part of it and smoke part of it later. And so these factors could influence health effects. The inhalation patterns affect exposure to toxic constituents. The more you inhale, the more your lungs are exposed to toxicants, and the more potential health risk there is. And we know again that because of the high pH, that premium cigar smokers are likely to inhale less than cigarette smokers. And again, that's a health issue. Next slide, please. So now let's go on to the health effects. So first, an overview, and then I'll talk about each of these in a little more detail. So the first point is, because of the constituents, and especially the size, premium cigars are not inherently less risky than other cigar types. Premium cigars expose people to toxic compounds and can cause disease. The health risk is directly related to how often premium cigars are used and inhalation patterns. So we know the vast majority of cigarette smokers smoke daily. About 5% of premium cigar smokers smoke daily, and the others smoke only occasionally. If cigars are used regularly and the smoke is inhaled, then the health risks are likely to be similar to cigarette smoking. So again, the use pattern is very important. Another important thing is, if you are a cigar smoker who have smoked cigarettes in the past or currently, because you've learned to inhale, you're more likely to inhale cigar smoke, leading to greater health risk. Premium cigars contain lots of nicotine, as I mentioned, and they have the potential to be addictive. Now, while the definition for premium cigars say no flavors are added, they could be added, and this could increase use and therefore health effects. And that's an important question that has to be monitored. Next slide. So to go through the specific health effects, again, cigar smoke contains constituents that can cause cardiovascular disease, lung disease, cancer, and other negative health effects. Cigar emissions are similar to cigarettes, and exposure to these chemicals can cause disease. And if cigars are used regularly and the smoke is inhaled, the health risks are likely to be similar to cigarette smoking. Health risks of premium cigar use depend on frequency, intensity, and duration of use and inhalation depth. Next slide. The committee did an extensive review of epidemiology on cigar use and health. As Dr. Teusch mentioned, there were no specific data on premium cigar use. They included all cigars. And so the effects that we saw could not be separated from premium cigars. But we know in general that regular daily use is more risky. There were not enough data to know if occasional exclusive cigar use increases health risks. And that's something that needs to be investigated. Since most premium cigar users smoke infrequently and are less likely to inhale, the population health risk of such users are likely to be less than those who smoke other cigar types. And again, this is not because cigars are inherently less dangerous, but it's because of how they're smoked and how often. The health risks of daily exclusive cigar use in general, this is not just premium, are clearly higher than not smoking, but are lower than daily cigarette smoking. And this appears to be because cigar smokers tend to smoke fewer cigars per day than cigarette smokers. The health risks in cigar users who have never smoked cigarettes are lower than those who have smoked cigarettes because they're less likely to inhale, as I mentioned before. The health risks are higher in concurrent users of premium cigars and other combustible tobacco products than exclusive premium cigar users. So again, if you smoke cigarettes and premium cigars, your health risk will be greater. Next slide. So the research that was available was really in the general population of cigar users, but there was no information on priority populations and high-risk populations. And these may include youth or young adults, racialized and ethnic populations, pregnant women, those with underlying medical conditions, especially cardiovascular disease and respiratory disease, and people with occupational exposure to premium cigars. So if you work in a cigar lounge, you may be exposed to a lot of secondhand cigar smoke, which could be injurious to health. I mentioned flavors before. So if one begins adding flavors to premium cigars, this could result in greater appeal to non-users and more frequent use, increased nicotine intake, higher addiction potential, higher exposure to smoke constituents, and more health risk. Premium cigars, like cigarettes, do generate secondhand smoke because they burn for a much longer period of time, the total amount that gets generated is actually larger. But there are no data on non-smoker exposure to secondhand cigar smoke. We think that many premium cigar smokers smoke outdoors, which will not expose people. But certainly if they smoke indoors and get in cigar lounges, non-smokers could be exposed to quite a lot of secondhand smoke. It's biologically plausible that regular cigar smoking can be addictive. I said there's lots of nicotine there. That includes premium cigars. The data that we found showed that the magnitude of dependence appears to be less than that of cigarettes and smokeless tobacco. And that's likely because of the pattern of use, which affects dependence. Next slide. So I'm going to turn the mic now to Dr. Danilbo.
Thank you, Neil. So we're going to switch gears now and talk about marketing and perceptions and what the committee examined. So the first conclusion that we have has to do with the way that premium cigars are marketed and different from the way that other tobacco products are marketed. The committee noted that third-party retailers are actively involved in the promotion of these products and use direct-to-consumer marketing methods for premium cigars. Additionally, the type of marketing strategies for premium cigars includes the use of lifestyle magazines and festivals to promote premium cigars, and the committee recognizes that these types of strategies and approaches could appeal to young people. Premium cigar companies have an online and social media presence. And what is noted here is that traditional marketing monitoring, it does not necessarily capture these particular approaches, and that traditional methods of tracking marketing expenditures for these products does not currently exist. Next slide. With regards to the advertisements and the imagery and the messaging in the advertising materials, premium cigars are advertised as less harmful than other tobacco products, and the marketing materials highlight benefits that will outweigh health risks, and a integral part of the messaging relates to a luxurious lifestyle. Where and how premium cigar users get their cigars differs from other types of mass merchandise cigars, whereas premium cigar users typically purchase their cigars online. And when they do purchase in person, it's from cigar bars or specialty shops, whereas non-premium cigar users typically purchase their products from convenience stores. We recognize that consumer knowledge of premium cigars, what is a premium cigar, including the definition, and whether or not consumers distinguish premium cigars from other cigars is unknown. We also recognize that the literature shows that cigars as a category are perceived as harmful and addictive, but there is no research about knowledge of the specific health effects of premium cigars on the consumers that use them. But we also recognize that lower perceived harm and addictiveness of cigars is associated with cigar use behaviors. Next slide. So now I'm going to go over the priority recommendations. The committee came up with 9. Our first recommendation is that the FDA, along with other federal agencies, should develop formal categories and definitions for cigars to be used for research to ensure consistency across studies. Our second recommendation grows out of this first recommendation, using this agreed upon definition for the different types of cigars that Health and Human Services, the Tobacco Tax Bureau, and the FTC should establish a system to monitor the surveillance and use patterns, product characteristics, industry marketing, promotion, sales, et cetera, by cigar type and make the data public. And we want to stress here that while the FTC currently does reports for cigarettes every 2 years, as well as smokeless, and is currently undergoing the same type of report for e-cigarettes. A report like this on cigars has not been done for over 2 decades. Our third recommendation is that Health and Human Services should improve the measures of premium cigar use in national surveys, such as PATH, the Tobacco Use Supplement, and the National Survey on Drug Use and Health, and that these survey systems should include lifetime use and smoking patterns, because much of the data that we were relying upon referred back to use in the past 30 days. And we recognize that the patterns of use for premium cigars are different and would be better captured with more robust measures with regards to use patterns. Next slide. Additionally, the committee recommended that the FDA, NIH, and other federal agencies should conduct or fund research to determine the unique types of marketing, advertising, and promotional practices used by companies that manufacture, distribute, and sell premium cigars. And they should also identify strategies for tracking these activities, particularly those that could potentially appeal to youth. Additionally, the FDA, NIH, and other federal agencies should assess consumer knowledge, awareness, and perceptions of premium cigars. Next slide. And with that, I'm going to pass the baton back to my colleague, Neil.
Okay, thanks, Chris. So just these recommendations are a little bit out of order in terms of numbers because we just wanted to lump them together in terms of sort of categories of recommendations. So recommendation 4 was that the Food and Drug Administration, the NIH, and other federal agencies should expand research on the association between premium cigar use and health outcomes. As I mentioned before, no epidemiology specifically looks at premium cigars. They basically lump cigars together. Some studies say what percentage were traditional cigars, which might include premium cigars. But there's a need to have specific research that identifies premium cigar use and health outcomes. Also, dose-response relationships data are needed. As I said before, there are very little data on non-daily use of cigars and what the health effects are. And such data need to be done to assess. We know for cigarette smoking that people who smoke non-daily are still at increased risks of several adverse health effects. And we need those data for premium cigars. Also need to know the effects of modifying factors like the co-use of alcohol or cannabis products, which could affect the harm from premium cigars. Recommendation 5 was that the FDA, NIH, the CDC, and other federal agencies should improve the quality and expand the range of premium cigar studies on the characteristics, chemistry, and health smokers' use of products. So we know what's in the filler. That can be analyzed. For cigarettes, there are standard smoking machines where you just plug a cigarette into a port and you get a standard reading of what the emissions look like. Premium cigars are much different from one another in terms of shape and size, and it's more of a challenge in terms of doing studies of emissions and know what's in them and how changing smoking characteristics change emissions. And so more research is needed on that. And finally, there are data that strongly suggest that premium cigar smokers inhale differently than other cigar smokers and cigarette smokers, but there are very few formal studies. And we need formal studies on inhalation, depth of inhalation, effect of different pH levels, et cetera. Next slide. So recommendation 7 was that the FDA, NIH, and other federal agencies should study cigar addiction potential. There are relatively few data on premium cigar addiction potential. And these studies should also include the effects of co-use of other tobacco products and of flavors and nicotine content. Recommendation 8 was that the FDA, NIH, and other federal agencies should investigate comparative health effects of different cigar types in priority populations. These include youth which would be adolescents and young adults, racialized and ethnic populations during pregnancy, those with underlying medical conditions, and people with occupational exposures to premium cigars. Next slide. So I'm going to turn this back to Steve.
Great. Thanks, Neil, and thanks to you, Chris, as well. So I'm going to return to the observations I made at the beginning of this presentation. First, that there is no material difference between cigar products in terms of their harmful or potentially harmful constituents. That said, there is a meaningful difference in how premium cigars are used and by whom. Well, we know what those use patterns are today. It's important to note that these patterns of use can change over time, and if they do, then the health effects of premium cigars will change as well. The final slide shows where you can get the a free download of our report, and has the contact information for our terrific study director, Amy Geller. You can contact her should you need any additional information, and she can provide access to information that's in our public use files. So with that, let me turn it back over to Stephanie to help us with Q&As. Stephanie?
Yes, thank you so much, everyone. And just a reminder for the audience, please use the Q&A box, not the chat box. And if you are comfortable sharing this, please do let us know your organization or affiliation. Our first question for the panel is, apart from the cardiovascular effects, do regular premium cigar users also have higher oral toxic or health effects in oral diseases than inhalation health effects?
Well, that is highly likely, depending on how much is used. We couldn't find any data specifically on premium cigars, but that is the case for other cigars.
Thank you. The next question, although tobacco is the same in each, are there not far fewer additive chemicals in cigarettes?
Neil, do you want to take that one too?
Yeah, I think there are more additives in cigarettes than premium cigars, in the sense that premium cigars have to be just from tobacco filler. Flavors cannot be added. There's a curing process which can certainly affect the characteristics, but in terms of additives, there should not be additives in premium cigars. Whereas in cigarettes, there are a number of additives that are added.
Thank you. Our next question comes from someone at FGA. Did the committee consider any studies of secondhand smoke health effects of premium cigars? And a number of questions about secondhand smoke have come up as well, so I'll do my best to combine. Another is, what environments did you consider when it comes to secondhand smoke, for example, cigar lounges?
Oh, if only there were more data. Neil, you want to tackle that one too?
So there are studies that have looked at secondhand smoke in the air, and cigars emit just as much or more secondhand smoke than do cigarettes. So there's no question that it's a source. And you can see if someone is smoking a cigar for 2 hours and it's smoldering for 2 hours, you could generate a lot of secondhand smoke. There are no human exposure studies in terms of, for secondhand cigarette smoke. A lot of studies have been done where non-smokers are in rooms or in cars with smokers, and studies of exactly how much is absorbed have been done. And we know that the biological effects are significant. No studies like that are available. There are not even studies on where most premium cigar smokers smoke their cigars. We think many smoke outdoors, but there are no data, and I think that's a research priority. In the cigar lounges, certainly having devices that can high ventilation would be important, but we have no specific studies on cigar lounges in terms of how much people actually get exposed.
Chris, did you have any additional information, comments on secondhand smoke?
Yeah, no, I mean, consistent with what Neil said, there just isn't any data, even from the survey perspective side, as to where premium cigar smokers smoke their cigars. I mean, certainly anecdotal data, but nothing we could find in the literature that the surveys would guide us to.
Let's shift gears a little bit to some of the marketing related findings and conclusions. So one of the report's conclusions is premium cigar companies have marketing practices that are not captured by typical tracking mechanisms. Can you say a little more about what led you to those conclusions? And perhaps, Kim, this would be in your wheelhouse.
Sure. Kim, do you want to take that one?
Sure. So our evidence suggests that premium cigars are marketed through online sources. They're marketed through websites, through social media platforms. We also found that these products are marketed through lifestyle magazines, as well as being marketed through festivals, as well as also through some direct-to-consumer methods. And what our evidence really shows us is that some of these marketing and advertising platforms just aren't really being tracked in the typical methods for marketing exposure. So our report is calling for additional research to really help us understand the unique practices, the unique advertising and promotional methods that premium cigars are being marketed by. And our report is also calling for the identification of strategies to help us understand these marketing techniques.
Thank you. The next question comes from someone at the University of California at San Francisco. Given the relatively low prevalence of premium cigar use, should we care about premium cigar health effects?
Well, so we'll start, but clearly we have a two-pronged issue. First being that the premium cigar itself is inherently harmful, and as we said, it's basic. The extent of those health effects are dependent on how those are used, the frequency, the intensity, and so forth, and by whom they're being used. And it's the latter that can change in response to any changes in the external environment, whether it's marketing, pricing, taxation, regulatory or policy changes. And so we have to be cognizant of those, and that those health effects can easily change. While on a population basis, the overall effect right now is probably modest. Over the longer term, that's not necessarily the case.
Thank you. The next question, this report has emphasized that there's this paucity of data on premium cigars. So can you tell us more about how the committee reached its conclusions?
Sure, there's a lot to be said there, but why don't we start with Miranda? Can you comment on that, Miranda?
Yes. So while there's a lack of studies on cigars that specifically looked at the premium cigars, we do know a great deal about the health effects of other combustible tobacco and about the patterns of use of cigars. So to reach its conclusions, the committee took several approaches. First, we reviewed the data on those toxic and carcinogenic constituents of premium cigar smoke, and we determined that these were substantially identical to those from cigarettes and other cigar smoke. We also reviewed the extensive body of literature on the health effects of tobacco smoke and studies on cigars overall. So using these data, the committee was able to assess the health effects of premium cigars based on the biological plausibility of those known health effects, as well as what we do know about the patterns of use of premium cigars. Thank you for that question.
Our next question for our panelists is, could you further explain the differences in usage patterns between premium cigars and other tobacco products?
Chris, that sounds like it was aimed at you.
Thank you. So through the commission papers that we had, as well as the review of the literature, what we know is compared to users of cigarillos and filtered cigars, premium cigar smokers smoke premium cigars on fewer days in the past 30 days. With respect to the prevalence of daily use, the prevalence of daily use among premium cigar smokers is less than it is for other types of cigar products, as well as for cigarettes. And then also the number of cigars used in a given month is also lower compared to other types of cigar products, as well as cigarettes.
For those of you who want a lot more detailed information, we did have commission analyses that have much more detailed information, and they can be found in the appendices. And those are papers that look at the National Survey of Drug Use and Health and the population assessment of drugs and health, of tobacco and health. So there's a lot more detail on those questions in the report itself.
Thank you. Our next question for you all comes from MedPage today. Our premium cigar, is there any idea of the trajectory for premium cigar smoking? Is it expected to remain steady, continue declining?
Chris, another one in your wheelhouse.
Sure. I think first, the point that I would like to reiterate that Stephen has mentioned previously is what the patterns of use will look like in the future will depend on how the broad category of cigars are regulated, taxation, marketing practices, et cetera. And so we recognize that those patterns can change. When you do look, however, at the tobacco trade data, the tobacco tax data, for this current year, we do see that the import of premium cigars is actually on an increasing trajectory. And so there are some data to point towards the fact that premium cigars the consumption of them has started to increase. Whether that is an indicator of more people using premium cigars or those using premium cigars smoking more of them, we do not know, and we need the survey data to answer those particular questions.
We also have a question. Is the toxicity associated with premium cigar use increased by the concurrent use of alcohol?
Neil?
For that, well, again, there are no data on premium cigars per se, but we know that the cigar smoke goes into the mouth. We know that cigarettes, small cigar smoke, can be associated with oral disease, oral cancer, and that there's a synergistic effect or an enhanced effect if you take alcohol at the same time as cigar smoke. So I think it's highly likely. Again, we don't have specific data, but there's no reason to think that the oral effects of premium cigar smoke would be any different than those of cigarettes or small cigars.
The next question is for those of you who are familiar with the Smoking and Tobacco Control Monograph number 9 report, can you perhaps summarize how your study differed or augmented the findings from that monograph number 9 study?
I'm not sure who the best person is to comment on that. So who would like to take that question? Sure, Chris.
Yeah, happy to take it. So I think one of the things to comment about there is that that monograph was done more than 20 years ago. And at the time that that monograph was done, there was very little data. And when we undertook this study, despite 20 years passing, there is still very little data. With regards to health effects, I do think that there was information in that report that proved useful to this committee. And with regards to patterns of use, I think there we have more robust data about who is using premium cigars versus not using premium cigars, using other types of cigars. And to clarify, with regards to consumption patterns, those commissioned papers identified premium cigar users by the brands that they reported. So it was not a question about, are you a premium cigar user, but for those people that identified brands considered as premium as the products that they used.
Thank you. Going back to your remark about who is using these products, an attendee asked, knowing that premium cigars are mostly used by white males of a higher socioeconomic status, how accessible are these products to other populations, including youth or young adults, racialized and ethnic populations, for example?
Kim, do you want to take that one?
Sure, and thank you for that question. So what our report does tell us, and what our evidence does suggest to us, is that we know that these products, again, are being marketed through online sources, through websites, through social media platforms. Again, they're also being marketed through music festivals. They're being marketed through lifestyle magazines. And while we don't have data to tell us specifically, some of these marketing promotions, some of these advertisements may be appealing to youth. So we need future research to be able to monitor the ways in which these premium cigars are being marketed, advertised, and promoted, and how that advertisement, promotion, and marketing does influence use, and how it influences use across different populations, such as youth, and racialized priority populations.
Chris, do you want to elaborate on what Kim said in terms of accessing these products?
Sure, I would just like to add one thing to Kim's points, and that's, this committee highlighted these third-party retailers that are doing direct marketing to consumers, and these third-party retailers all have a presence on the web where these cigars can be purchased online, and whether or not there is age gating as to whether or not youth can buy these products without having their age verified is something that should be looked into. Anecdotally, people can go to these third-party retailers and look for themselves whether or not it asks whether or not you're 21 before you access the materials on those sites.
Thank you. Our next question is, premium cigar imports are reportedly up, and the report does talk about what other countries they may originate from, but how do you talk about consumption without any data?
Chris, that sounds like yours too.
Yeah, thank you for the question. I'm trying to understand how there is no data when we know that imports are up. The imports are up in the Tobacco Tax Bureau, what they're tracking. And you also see business to business, trade magazines, et cetera, premium cigar magazines talking about how imports are up. So consumption is up. How consumption is up, we don't know. And as I stressed before, when the sales of products go up, that is a function of either more people using the product and or those that use the product using more of it. So it could either be that prevalence could be increasing, or it could mean that consumption and the frequency patterns are becoming heavier, or a combination of the two. So we certainly do know that imports are up. How that has impacted the consumption patterns currently is an unknown, which ties back to the importance of our recommendations of these surveys.
Thank you. We have a few questions about, the topic of flavoring. So by the committees, can you walk us through the committee's definition and, by your definition, is a cigar with flavor additives still premium, and how might that contribute to different patterns of use?
To be clear, in our definition of a premium cigar, it could not have flavorings or additives. That said, it's an important question about how flavorings can affect use, and they clearly could be added to products like premium cigars. So, Neil, do you want to talk a little bit about the topic?
Yes, so one question that was asked by the FDA is what would be the impact if flavors could be added? So while they can't be added now, and we should just say that premium cigars have flavors that come from the product itself. There can be aromas where they're stored. So for regular premium cigar users, different cigars taste differently. In terms of adding flavors, though, if the definition changed and flavors were not banned, if they could be added, then what would be the impact? So that was the question we were asked. And no question that adding flavors can influence appeal and can influence who's using the product and how much it's used.
Thank you. I'm going to do my best to combine questions here again. Did the committee look into, how toxins might differ by premium cigars across countries of origin? And then another question is, in a lot of entertainment media, it shows Cuban cigars as being both illicit and of premium quality. Is there any data on use of Cuban cigars and whether those are perceived as premium compared to other types? This is again from MedPage.
That was a whole series of questions. I guess let me ask Kim and Chris to start in terms of promotion of what we know about promotion of those things and their use. This wasn't a great focus of our work, but if you have something to say, please comment.
So I'd like to speak to the perception issue, right? And how consumers perceive premium cigars. So at the moment, we have no data that give us any indication of consumers' perceptions of premium cigars. We have no data that really indicate to us how consumers can distinguish premium cigars from other cigar types. We have no data really about the types of brands that consumers consider to be premium cigars. So our report is really, and it highlighted that we need more research. We need more information about consumers' knowledge about premium cigars, including those brands that they may consider premium. We need more research about their thoughts and their perceptions about premium cigars, and we need more information truly to tell us if consumers are indeed able to distinguish premium cigars from other cigar types.
Thanks very much for that. And thank you also our panelists for the rapid fire questions. We are coming up on time, so this question will be our last. Which of your recommendations could immediately be implemented, and which of your recommendations are longer term?
So we didn't actually categorize them that way. We think most of these recommendations could be moved on reasonably expeditiously. I think if you look back, many of the research recommendations that were made in the 1998 report were not executed. It's been 20 years. They could be, but certainly some of the things such as the definitions, the surveillance, the initiation of some of the longer term health studies can happen now. Now, we may not have the results of some of them for some time, but one could move expeditiously on most of them. I think that if you ask the committee, we would say the first 4 of our recommendations were the highest priority. in terms of, where should we start? But the other 5 are important as well. And if you read through each of the chapters, you'll find a list of research recommendations or research gaps, at least, that could be filled. I think it's imperative that we look across the board there and start.
Well, thank you kindly to all of our panelists for joining us today, and thanks to our attendees. We did have a few hundred people join today's webinar, so I do sincerely apologize if we didn't have time to address your question. But once you exit this webinar, you'll automatically be redirected to our report page. That is where you can download a free PDF of the report and some other materials. And in the next week, you should see a recording of this webinar on that page as well. Once again, I'd like to thank our committee members for their hard work, and thank you all again for joining us today. Have a great rest of the day.